Hi everyone, I'm Harriet Madigan, and I get to be the host of the Village Living Well series, Faces and Stories of Northern Ontario. And our goal for our team is to focus on lessons we learn from the stories of our fellow human beings in the community and beyond. So, hot topic today is the sandwich generation, caught in the middle. So I'd like to start off by welcoming our panelists. So we have three wonderful guests who have volunteered to give their perspective. And I won't use the word expertise because nobody's an expert, right? But these ladies bring lots of lived experience, and that counts for sure. Our first guest is Lynn Guy Otoniker, there we go. Lynn Guy Otoniker, Heart's Home Care. She owns and operates this business. Heart's Ease Home Care offers private in-home supports and home health care services. Lynn is a registered nurse, graduated from the University of Ottawa in 2009. And of interest to all of you is that she won Best Home Healthcare Business for 2023. Our second guest is Alana. Alana is a health promotion facilitator with the Alzheimer's Society of Sudbury, Manitoulin, North Bay districts. She holds an honors bachelor in physical health education degree from Nipissing University. She's conducted many trainings and presentations for the Alzheimer's Society, which some of us have been party to, which is great. She is dedicated to creating awareness in the community to improve the lives of people living with dementia and their caregivers and partners. Alana facilitates programs such as Minds in Motion to encourage people living with dementia to stay active and social throughout their whole lives. And our third guest is Wendy Smith. Wendy is a physiotherapist who's worked 20 years in a clinical capacity prior to shifting her career to work on system-level issues within our Ontario healthcare system. As the executive lead for the Nipissing Wellness Ontario Health Team, Wendy is working with other healthcare providers and leaders across the province to implement system change that will improve the lived experience of healthcare for people across the Nipissing district. So I did a little research, as I should have, on what does the sandwich generation really mean? And this was the best definition I found, and it says that the sandwich generation is a group of multi-generational caregivers sandwiched between caring for their children and aging parents. And this is a quote from The Place for Mom by Carol Abaya. And then she goes further to say the traditional definition was adults sandwiched between aging parents who need care and or help for their own children. And then there's the club sandwich. Adults in their 50s or 60s sandwiched between aging parents, adult children, grandchildren, and then there could be adults in their 30s or 40s with young children and aging parents and grandparents. And then the open definition is anyone else who's involved in elder care. So it's pretty broad. So again, I want to thank our panelists today for commenting on some of the stories I'm about to read. And I want to say thank you to the 6 people who donated stories to help us get a better perspective of the sandwich generation. So here we go. First story. As a young immigrant to Canada, it is easy to think of a fresh start, new experiences, and a rosy future in Canada. Later in life, the harsh facts that one remains permanently divided with family left behind, and then the task of managing aging parents in a different country. Receiving a phone mail to say a parent is in the hospital or close to dying means a huge upheaval, and the struggle to juggle begins. Costly airfares, finding caregivers to manage my young Canadian family in my absence, begging for support in the workplace, and that surreal feeling of being stuck between a rock and a hard place was certainly traumatic. In my personal experience, the hunt for a nursing home and trying to navigate a totally different system of healthcare, relying on a few relatives and costly transatlantic phone calls was a nightmare. Then the anguish of leaving a grieving parent behind, later cleaning out the family home, sorting out finances, and returning to Canada immediately after led to depression and a huge sense of failure. I remember the feeling of frustration upon my return when no one could relate to me. I was just simply back for my family, back at work, and back to normal. Managing a parent in a nursing home and relying on a sister to do the lion's share despite her own battle with cancer was horrendous. This is not unique to me, and I share so many stories with other immigrant friends who feel so torn and divided living between the two worlds. So I'd like to invite you to just, let's start the discussion. Do you want to start, Lynn?
Sure. So first off, I want to say thank you for the opportunity to be here. It's really great to be able to hear some of the real stories that happen to people that live in our communities. So I think at first the most important thing here is that we are, as a system now, trying to pay more attention to these kinds of stories from the front line, and the system is more aware of the need to really engage patients and families and caregivers in system redesign. And one of the biggest concerns at the moment is caregiver burnout as a whole. So maybe not so much focused just on the sandwich generation, but in general, just recognizing the tremendous input and load on people who are at home caring for their loved ones, and the increasing demand the system is putting on them to do so. So I think that the most important thing right now is that we continue to have the discussion. This is a great start. And I also think this is a unique story because this highlights that our Canadian community is becoming much more multicultural, and we need to have resources that meet the cultural needs of all and not just those that are born in Canada.
Thank you. Alana?
Yeah, I'm here talking on behalf of the Alzheimer's Society, so it's kind of tricky because I know not all stories will have something to do with dementia. But dementia or not, right, there's a lot of these situations where people find that they're caring for loved ones on the other side of an ocean, right, which is a really unique type of stress. And I know that individual said that just this challenge of not having other people who can relate. Right? We see that in people in a care partner role who don't even have loved ones on the other side of the ocean, right? Just people not understanding what is it actually like to be that care partner. And so I think to try to find that community of people who actually understand can be super helpful. And so I know there's all sorts of different, caregiver, care partner support groups out there. And so I would really recommend that. To try to find one. I know if dementia's involved, right, we have a care partner support group through the Alzheimer's Society, and we've just found that people just feel so heard when they can go to those support groups and just bounce ideas off of each other. What worked for your family? What were some of the challenges for your family? I've been encouraged even by some people's stories in the creative things they've found to help cope. So I know technology is tricky with older adults, but yet there are some people who have been able to be creative enough to find ways to help older adults use it, right? And so whether that's implementing classes or having someone else who lives nearby popping over to set up the Zoom call, right? So that they can actually see their family members face to face, right? Or maybe it's a matter of keeping some kind of journal of what actually happened that day, right? Because maybe by the time they have their phone call with their family that evening, it's actually hard to remember, who they saw that day or what happened. And so for a care partner managing care back, maybe in Canada, how are they supposed to keep track of whether or not the people who provided support actually came that day? Right? But if you ask those people to maybe sign in the little journal in the front hall, then maybe it's easier to translate that information back home to Canada. So all sorts of different creative ways that I think might be worth considering.
Lynn?
Yeah, thank you as well for having me. The one piece that you mentioned is the person voice that they felt really lonely. Being a caregiver is a very lonesome place to be, whether it's a parent, a child, a friend, a neighbor. And just, I think, sharing these stories and having these events, I think will create a sense of belonging and take away some of that loneliness. I think once you realize that you are not alone, that will go a long way on its own.
Right. And like-minded people, but, you know, whether, no matter how old you are, some of us are facing this because we're living longer, right? And, yeah. Thank you very much. That's wonderful. So I'll go to the next story. According to my husband, to make a great sandwich, you have to get the ratios right. Too much jam and the sandwich is too sweet. Not enough peanut butter and the sandwich lacks body. You get the point. This metaphor also holds true for the sandwich generation as well. Spending too much time on one loved one at the expense of another or yourself can have a negative outcome. My first experience with this occurred when my 90-year-old mother required more support to age in place. I work full-time in healthcare management, and knowing our budgets have been cut by the government and transferred to community healthcare services, I thought we would have no problem securing adequate assistance. Sadly, this was not the case. Navigating the various agencies and options was tedious and time-consuming and could only be done during my own work hours. Every organization, company, and individual I dealt with complained of staff shortages, impossible caseloads, and burnout. Throughout this journey, I was fortunate enough to have a wonderful husband, son, and an out-of-town sibling who helped where they could and understood all my time spent helping my mom, but still, I became exhausted, stressed, and guilt-ridden that I was somehow failing everyone. Our aging society needs to lobby all levels of government and advocate for a more efficient, comprehensible, and effective portal for acquiring community health services. Getting the ratio correct will certainly make this sandwich more palatable. Well done. I'm going to start with Lynn. Lynn, if
Yeah.
you'd like to comment on
Sure.
that story.
Yeah, so I work in home care. I offer private in-home services. I was working for the government, and I noticed lots of the gaps in the system. It's not a secret. There's a human resources shortage right now, and it comes in every sector, but certainly in the healthcare sector. And the resources are extremely limited in the public sector. So one of the things that we encourage families to do and caregivers to do is find help. So whether that's a formal or informal helper. So for myself, I'm a formal helper. People can pay money to get the extra help at home. And with the private sector, it's a little bit more tailored to person's individual needs. I know at the government, there's certain things they can and cannot do. Certain people qualify, certain people don't. And depending on the need, there's different priorities, different number of hours allocated. So that can be challenging. And sometimes what the government gives is not what the family needs. Every little bit helps, absolutely, but sometimes it's not enough. And caregivers are still left stranded, burnt out, and feeling alone. So yeah, it's just the reality of our system right now. And my clients say it all the time. I called the home care office and the case manager said, you know, it is what it is and we don't have anyone. There's just, people don't like hearing that, and there's really no way around it at this time, and everyone's doing their best.
That's right.
But yeah, so that's where it's important to, if you can get in the system, whether it's a referral to the LHIN or the Alzheimer's Society or even a private service, that really gets the ball rolling to get you connected to multiple other resources in the community. A lot of people don't know the help that's out there. So they feel like there's no help, but there is help, they just don't know about it. So again, just just reaching out to the one person can really get you connected with all sorts of different help. So I think it's important to reach out if you feel you need help.
Thank you. Lana?
Yeah, as this individual mentioned, this isn't a perfect system, right? There are more needs than there seems to be the help. And there was a study that was recently released. They titled it the Landmark Study. And you can find it on the Alzheimer's Society of Canada's website. But the whole concept of this study was navigating the path forward in dementia care. And what are the projections, right? And they're not super promising, right? By 2050, we're expected to see 3 times the number of people living with dementia in Canada than we have right now. And so the big question is our healthcare system going to be able to keep up with that, right? And so this study outlines some recommendations to government in terms of what are those things that we need to be doing kind of preventatively to be able to handle that once we get there. And so I just want to say that I totally understand that this is a real problem, right? But I think, as was mentioned, right, this whole idea of trying to find that help that does exist, right, can truly be a challenge. But having those connections is super helpful, right? And so in cases where someone is diagnosed with dementia or thinks they might have dementia, we do recommend that they do an intake with the Alzheimer's Society, which is free. And we pair them up with someone who we call a First Link Care Navigator. And so the idea is they have one person in the Alzheimer's Society who becomes their go-to person. And it can kind of make it a little less overwhelming because that way you only have to talk to one person in the Alzheimer's Society. And then that person is trying to help you find those different supports, those different programs that may be of benefit to you. So from a dementia perspective, that is certainly something that we recommend and people find a bit helpful in terms of that navigation piece.
Wonderful. And you have a great website too.
Yeah, there's a lot on the Alzheimer's Society of Canada website about a lot of the topics we're talking about. So yeah, you can certainly go on there and search a topic to try to find up-to-date information.
Wendy?
All right, so I could talk for hours, but I think the most important things to say are that as much as the family and individuals going through this experience are stressed and challenged, the system is equally stressed and challenged. And there is a definite awareness within all levels of government. Not that I don't want anyone to think I represent government. I don't. I'm the executive of the local collaborative of health organizations that are supporting NIPSing, but I am by no stretch of the imagination a payer or in any way a decision maker around funding. So the system is aware, and I think the most important thing at this juncture point is that we continue not to bang the drum that the system is broken, but contribute to the system healing itself by sharing news about what the solutions are that individuals find. So the concept of a ripple effect. So if you know someone who has gone through this kind of challenging environment, and I have to say from my own personal experience, I lived this within my own family. So when someone has gone through this and found solutions, it's important that we scale those so that people start to understand how to make those connections, and it's less stressful for everyone down the line. One other resource I really think is important for people to recognize in this space is the Ontario Caregivers Organization. So they actually, OCO, actually has a phenomenal website, and they're also doing a lot of work that the Ontario Health Team locally is promoting, which is to help employers understand the impact of this kind of stress on their employees and to help them start to understand how they help their employees that are in this kind of situation to navigate the mental health aspects of this, because it's real. And so I think that's one resource. And the other is the Ontario Health Team ourselves has a website similar to other member organizations that we've done a lot of work on it to create a navigational resource in collaboration with Canadore and others So we're trying to create this one-stop shop place for people to start to help navigate the system. So if you haven't seen it, please go in and have a look and let us know what you like, dislike, how you can improve it. Yeah, we're here to listen.
And I'm going to ask that you if you could send me those links.
Yes,
Then we can include it in the webinar.
Yes.
And be another resource for people to listen to the stories and find, that they're not alone, for sure, and that there are resources out there, and it's getting started.
That's right.
Right?
Yeah, that's right.
Okay. All right. Thank you. I also had a thought about caregivers that are employed to be caregivers. And how stressful that might be. And recognizing that they're human beings too. And, it must be difficult to go into a new home occasionally and not as frequently, to not have that common connection with the person that needs the caregiving. I wondered what that might be like. Interesting.
Yeah, I think that's a really, really good point because people go into caregiving because we as a collective group want to support, and so the recognition that we're not able to give what we see people need, a lot of people take that home with them.
Yeah.
And so that contributes to caregiver burnout on the provider side, and then what you start to see and what we really live right now is that nurses, particularly in PSWs, are quitting because they just can't handle that. Right?
Yeah, so I can speak on that personally, and that's why I made the leap from the public system to the private. When I was a care coordinator, I had families every day asking for help, and lots of times I really left feeling like I had not been able to help them in the way that they needed. And it is exhausting and it's unfulfilling. And I'm a nurse. I chose to be a nurse because I wanted to help. And I was just feeling like I was not accomplishing that. And I think part of it is, you have to think of the positives of the little changes that you've made. And of course, we helped in some way. And I don't know if it's the public's expectations that are maybe not realistic, or because the system has changed a lot from when their parents were maybe their age, and now they look at it and they say, oh, my mom, she used to be able to get this and this help at home, and now we don't have that. And also our society is not built like it was before. Maybe one person in the family had to work and the other had more availability to help the kids or the parents. And now we're really finding that homes must be dual income with the price of everything. So there is no time. And it's not like one person can take a year off to help mom or dad. And there's not a lot of compensation for caregivers unless it's end of life or critical accident. So it's just really tough to make the time, but also financially as well. It's almost impossible, I would say, for most families to, take the time off of work. And then again, the employee assistance programs, they can help, but in terms of taking time off to be there with someone, to be away from work, there's not, I don't know of any other than for compassionate leave through the government, through EI. So there's just, you kind of stuck between a rock and a hard place, for sure. Yeah.
Thank you. Okay, ready for, I think this is story number 4. It's difficult to frame a long and arduous journey of caregiving a loved one with dementia into a brief account. Sandwich that story with one of continuous concern for adult children and grandchildren who are struggling, and you get a hot mess of sleepless nights and frayed nerves. My focus in this discussion is to share a few strategies that ease the burden of coping and caring for a loved one with dementia. My caregiving journey came to a rolling boil several weeks ago when it became apparent that my efforts to keep everyone afloat was not a tenable situation. Excuse me. I could no longer go it alone. I needed help. But where to find the help and how to navigate the system? My first course of action was to recognize that true to the saying, it takes a village, that I needed to build a team. My action was to recognize, my beloved 96-year-old mama was a major concern as she seemed most vulnerable. I consulted with her GP and we discussed the need for long-term care. First team member established. I then added my own physician to the team. I couldn't help anyone if I was a train wreck. The first time I called for an ambulance and took Mama to the hospital, I was introduced to a GEM, geriatric emergency medicine nurse, who guided us towards 3 local agencies who could help. Home and Community Care, formerly the LHIN, Behavioral Senior Services Ontario, and the Alzheimer's Society. And hopefully we'll get all those links in the description of the webinar. 3 more members joined my team when I was appointed with a wonderful case counselor at each of these agencies. The best part was they all worked in close affiliation, so the sharing of information was immediate and reliable. From that point forward, I felt supported and did not hesitate to call upon any one of them in my numerous times of need. I especially appreciated the personal counseling I received when I was feeling particularly tired, guilty, and defeated. There are those 3 words again. Finally, I would like to add that another key opponent was reaching out to friends and family. Caregiving can be a lonely, frustrating, and arduous journey. When someone asks, how can I help? Scan your list of to-dos and take them up on their offers. A copy of an old Eaton's catalog, thanks to Carol. Customized CDs of old country favorites, thanks to Joni and Ray. And lovely cups and saucers, thanks to Noreen. Drawing on, friends. And I'm going to open it up for discussion. Go ahead, Elena.
Thank you. So first I want to touch on the fact of this whole idea of taking care of the caregiver or the care partner, right? And how at the beginning of these journeys, it is very overwhelming, right? And so to kind of recognize from the beginning, this might be a long journey and it's probably going to be hard and it's going to be a lot for one person to manage, right? And so if right from the beginning you can realize, like this individual said, I'm going to need a team here, right? I'm going to need more than just myself. Because the other thing is unfortunately, most people living with dementia don't actually have that many people in their life who can fill that role of caregiver, right? Especially since lots of families are really spread out geographically, right? You might have, people in different parts of the country or in different cities far away from each other. And so the idea is, how can we keep those people who are in that caregiving role healthy and supported for as long as possible, right? So that they maybe don't get as burnt out, right? So that they can keep being that caregiver. And a lot of people really struggle with that because they think it's selfish to take care of themselves, right? But ultimately, it's the most loving thing you can do for the person living with dementia, right? Because it actually enables you to keep being able to love and serve them. And so I wanted to kind of open with that to just emphasize how important that is and how happy I am to hear that this individual got connected with all those agencies, right? And a lot of people actually don't even make it past their family doctor, right? A lot of people maybe get this diagnosis of dementia from a family doctor, and they don't always actually even know what type of dementia they have. Or maybe they are never given a referral to another specialist, right? Maybe they don't try to see a neurologist or someone who specializes in geriatrics and that kind of thing. And so it can be really helpful to see different people within the medical system to get more support, more advice, more guidance. But then at the same time, really leaning into those supports that hopefully you already have in your life. And a lot of people are often frustrated with their friends and family because maybe they're not receiving the kind of support that they had hoped, which is quite understandable, right? We all have people in our lives that we really hope we can count on if we're going through a hard time. And how I encourage those people sometimes is the fact that sometimes their friends and family actually just need a little bit of education, right? Sometimes they actually do want to love and support, but because they don't have a very good understanding of what dementia is, they actually don't fully understand how it can impact someone's day-to-day life so much, and how that can be so tricky for the person not only who's living with dementia, but also for the person in that caregiving role. And so I really do encourage people, if you have friends who are willing to learn more, I recommend that they take our Dementia Learning Series. So we meet together for 2 hours a week for 4 weeks, either in person at one of our offices or online. And we learn about dementia. We learn how to communicate with people with dementia. We learn about how to respond to responsive behaviors. We learn about some of those community supports. And so education is a big piece there. And just taking people up on their offers for help, right? To recognize, I can't actually do it on my own, and I would really appreciate your help is huge.
And I think the village is running that program.
Yes. So we have some different community organizations that have opened up their spaces to us, which we're very thankful for, so that we can offer these learning series in places that aren't just our offices, just different places in the community. So that's huge.
Wonderful.
I can go if you.
Sure.
Yeah.
Go.
Okay. Just to add a few things. I think sometimes it happens really quickly. You don't realize, okay, mom had a fall, and then from there on, it really snowballs quickly, and then you're in the thick of it, and you're like, wow, I've never even saw this coming, and you're in it. So maybe early prevention, again, talking about it, events like these, just to make people aware that when you're a caregiver, these are the things that can happen. And like this person, it took an ER visit to really get connected, whereas there's a big chance, maybe I don't know the details that led up to this visit, there's a good chance that they could have used the help before the ER visit. And then, like you said, some people don't make it past the family doctor. So education with the physicians, and we do see that lots. There's a diagnosis, sometimes we don't understand the depths of it, what type of dementia, and so if the physician was more educated, they could make those referrals right away. They could make those referrals to specialists or to the Alzheimer's Society or to support groups or community resources that can help. And then, yeah, so it happens quickly, and if the physician right away would put those referrals in place, and then also to recognize that there's different types of help out there. The story mentioned, or did you mention, sometimes people don't help in the way they think they might help, and I don't know them all by hand, but in the caregiver role or support role, there's all sorts of different types of supports that you can get, like making a CD. That's probably not something that she called and she said, oh, can you make me a CD? Probably when she called, she said, I'm super overwhelmed and I don't know where to do or where to go, what to do. And then she made her a CD, and you don't realize the impact that has. And sometimes that's the type of help you need. You don't need someone to go wash your mom or to go run errands. Just like giving you a CD that can be helpful. So just realizing that sometimes the help is not what you expected, but that everyone is good at helping in a different way. And all those different little things are very important as well.
And it's kindness.
Yeah.
This is using, putting kindness first.
Yeah.
Go ahead, Wendy.
So I think this is another great example of a success story, because to the points already raised, this individual did recognize the need to build a team. They did recognize that their own health was part of the solution, and that they didn't step away and reduce that So they did pay attention to the need. So I think that that's something people need to see, because if people are feeling guilty about needing care or having their own issues, and they see that their peers are reaching out for help, then they likely will feel better about doing that themselves. The other thing that I know personally from my own experience is that people will often say to you, "Oh, how are you?" The expectation in our society is the answer is fine, right? So the majority of us, if we say, "Oh, how are you?" you give them 30 seconds and you move on to another part of your conversation. So my suggestion is that we start to socially popularize the fact that we actually sit down with someone we know is struggling, and don't start with, "How are you?" Start with, "What's happening today?" or "Can you tell me about your experiences this week?" or something that allows them to really give you what is truly happening, because otherwise my response is always fine, right? Because I know people aren't really wanting me to unload what's really happening. And I think that the permission to do that then opens the door, and then people will start to say, "Okay, this is what I need. I need a CD, or I need to have a space. I need 30 minutes to just be me." For me, that was my car. I'd get in my car and I'd go nowhere, but I was in my own space and I could do me for 30 minutes, right? So the permission to go and do that was great, and that's all I needed. So I think it's just having that conversation. And also I love the comment about being prepared. So we don't do it, but we all know that at some point in our lives we're going to hit this issue. So we need to have those conversations earlier with our loved ones to understand what are your interests, what would you like me to do for you, and start to build that network of supports before you need it.
I agree. I mean, I hear the words education. I hear the word socially socially connecting, and remembering that whoever's in that caregiving position is still a human being.
Yes.
And that's beautiful. Okay, we're ready for story number 4, it says here. Taking my personal situation out of the equation, sandwich generation is a tough route. To be very concise, many individuals are dealing with children, grandchildren, spouses, elderly family members, aunts and uncles sometimes. Elderly parents and parents-in-law is not fun. Trying to navigate a system that is understaffed, underpaid, unhappy, and unreachable is very tiring, stress-filled, and unnerving. Issues that I dealt with, but don't just affect me, include things that should be simple but weren't. Who does what, trying to find a phone number, accessing which agency you should call, for what, names of agencies and acronyms, getting to and from appointments, language barriers, appointment waits, parking, revolving door of staff, rarely the same person dealing with your case for any length of time, having to explain and re-explain time and time again, having to provide the same documentation multiple times with the same agencies, having to go miles and miles away from home to reach specialists, tons of time on the road for ill, tired, sore, confused seniors and caregivers. Receiving absolutely no empathy for the senior or the caregiver, no respect to senior. For example, speaking to a caregiver instead of senior, and elder abuse is something else that might be mentioned. Within facilities, bathrooms few and far between, having to get keys to access bathroom facilities, locked doors with no one to give you access to where you need to go, and so on. These are some of the issues. There are so many more. Something has to be done. Our seniors are due respect. Our current system seems to forget the valuable assets they wear and continue to be. Wow.
Yeah.
I don't even know who to start with.
I can
Okay,
take
Randy,
I'll take
go
a
ahead.
stab at that one. Yeah. So again, I think there's a sense that no one's listening, and that can't be further from the truth. People are listening, but system change takes a long time. So we have a system in Ontario, in Canada, that was built for healthcare 30 years ago. And so the structures are in place that support that, and the whole system is in the process of trying to modernize that to meet the needs of current day. So we're in the process of doing that, we hit COVID. So I think we have to remember that everyone's doing their very, very best across the system. And so every time there's someone that has a solution, we need to populate that. We need to push that forward. So when you have a complaint, there should also be a suggestion of how that could be improved, because that helps then the people making the decisions about how to improve things to know how to channel that complaint, right? Complaints by themselves don't necessarily get us anywhere.
With people on the defensive.
That's right. And people, yeah, so we need that, and we need to grow the positive as opposed to focusing always on the negative, because that doesn't get us anywhere. And then otherwise, the system, the people that make decisions in our system, which are way above my pay grade, they don't live the front line. So we always say you don't know what you don't know, right? Mm-hmm. So they know what they get told through their channels. So the more we can feed them through those channels, the more they are aware, and they are trying their best to make those changes. So we just need to keep those communication channels open.
Thank you. Alana?
Yeah, the one thing I really picked up on there is this idea that, you know, things that are simple aren't simple, right? We want to be able to do just those simple day-to-day things without all these extra challenges. And in my line of work, we see that especially for people living with dementia. And we know how detrimental to one's health and well-being social isolation is. And yet someone who's living with dementia can very easily become socially isolated. And so we try very hard to enable them to keep doing all those things they love doing for as long as possible. But a huge part of that comes right back to education again, because people in our community don't have the education necessarily needed to support someone living with dementia who tries to go and do those normal day-to-day things. And so we actually have a program called Dementia Friendly Communities, and we will do this training with any community organization who wants to do it. And so our goal is to go into all sorts of different places, whether that's banks or grocery stores or restaurants or places of worship, and teach them how to best communicate with someone living with dementia, right? Which picks up on that comment there, in that, you know, they're not even talking to the person, they're talking to the caregiver, right? Which is not great at all, right? That's really not what we're wanting, but giving people that education about, you know, what are some of those things that you can alter in your communication that are gonna help when you're trying to talk to someone living with dementia, but then also looking at the physical environment. And so what are some of those physical changes we can make? And so even understanding some of the brain changes in dementia and how the brain might interpret different colors, that might actually change some decisions about what color of mat you're going to use, right? Or if you're realizing how distracting mirrors could be for someone living with dementia who might be time traveling and not recognize their current appearance, then maybe creating some bathroom spaces that aren't covered with mirrors is going to be helpful, right? So that training opportunity is something that we're really thankful to be able to offer, and we certainly would recommend people who are getting frustrated with community spaces to recommend that training to them, right? To take action and try to work towards a solution.
That's one of those, I didn't know that.
Yeah.
And I'm really happy to know that.
Yeah.
And the one comment I would have to add to that is that the businesses that are connected to older adults, like for example pharmacies, you know, and they need, I shouldn't say, I want to should on anybody.
It would be helpful.
They should have a training program for their new employees, for them on how to respond to older adults, because there may be a physical limitation, there could be a mental limitation, but to treat people with the same respect they would want for themselves. So I hope that businesses start reaching out, or that there's a program where it's offered to the businesses so that they can make change and maybe implement some kind of training for their staff. They have to. I know there's so many shortages, it's hard to say, but it's just something I was thinking about. Go ahead.
Yeah, you've both
Yeah.
covered it, and you as well, Harriet. Like, it's just the education, and I'm happy this person shared this story. There's some of the challenges I hadn't even considered, you know, the bathrooms, like obviously the parking, but I think that goes beyond just the parking. Like, and you know, you get to the bathroom and it's locked. Then you got to walk who knows where to get a key, and then there's no one at the desk. And just, this really highlighted a lot of the challenges that sometimes I wouldn't even think about.
Well, it's going to be in a webinar.
Yeah.
I'm learning a lot, and I'm saying, and I want to say thank you again, because this has been very, very interesting. Okay, last story. My sandwich journey began with my mother, an incredibly independent, self-sufficient, and loving, generous woman. We noticed subtle changes in her early 80s, and so did she. At her request, I accompanied her to a family doctor's appointment. Her doctor of 40 years was not ready to acknowledge the changes in her as her family had been observing. In the meantime, the management at her apartment building reported frequent burned pots and other behaviors unusual and sometimes threatening to self and others in her building. Family doctor related that she wouldn't be admitted to hospital to do a geriatric assessment unless she volunteered to do so or had a fall. Not happening, until she ended up calling an ambulance 3 times in 1 week. She was diagnosed with dementia at 87 after an assessment and placed in a locked ward in a private nursing home. It was an 11-year journey before she passed. As caregiver for Mom, I was also caring for 3 teenagers, mom, spouse, and working full-time. There was no real plan from medical professionals for referrals to help cope with the stress of caring for so many. There was a lot of guilt, anger, and remorse. Family and friends weren't always available and wanted to hear unpleasant behavioral situations. So I'll invite, do you want to start, Glenn?
Yeah, sure. I think the piece that hit me in that story was the physician didn't really address the severity of it. And I do see that a lot in people who are trying to get a diagnosis or help, and family raises their concerns, but the family doctor, they only get a glimpse in time, maybe 10 minutes with the patient and the family. And, you know, even though the family says, okay, there's been 3 burnt pots, or there's wandering, or we're really concerned about their safety, sometimes the issues are not addressed in a timely manner. And then these people are living at risk, and that's when we see they become admitted to the hospital, unplanned admissions, and where, you know, some of this could have been prevented. So again, just education, early prevention, I think, are really key. And to just keep advocating for the people you're caregiving for sure, because sometimes, you know, you got to call the doctor 2, 3, 4 times until what you want is done. So it takes time, but that's not fair to the people who are caregiving. So just to keep advocating and keep pushing for what you think is right.
Wendy?
I wanted to comment on the advocacy. So I'm glad you spoke about it, Lynn. I think first off, it's unfair that we have to, in this system, have advocates for patients. I recognize that it's unfair, however, it is necessary. So there are some people who are really good at advocating for themselves or their family, and there are people who just can't, they don't feel comfortable doing that or challenging other people. So I think it's important for us as people who are more in the awareness of things to help those that don't feel comfortable advocating know where they can reach out to find an advocate. because in this system you do need an advocate, and so making sure people can find that connection to help them support the navigation and getting to the services they need. I also kind of want to bring up an idea that's percolated across some of our OHT members, is that we used to have, when I was a kid, dating myself a bit, but we used to have that neighborhood watch. Remember neighborhood? Most people will, yeah. So there's this concept that the same thing could be true for seniors. Why did we only do that for children, right? We could also do the same thing. So as neighborhoods, we can be kind of cognizant of the fact that we see someone struggling, or if you live in an apartment building, you can say, oh, I'm just going to raise awareness that there might be something going on here, and then just even providing that support people, those support people with where to go to get information, I think is going to help. But yeah, advocacy is real.
Yeah, and just to kind of echo what they said, first, I really kind of want to applaud this person in terms of recognizing those early changes, right? Some people don't recognize that someone might be experiencing symptoms of dementia until it's quite progressed, right? And so recognizing that off the bat and then trying to bring that up to the family physician was a great first step, right? But, as was mentioned, I would really, recommend trying to advocate for a second or a third opinion or referrals to specialists. But the other bit is this whole concept of education again, right? And back to this whole, community or neighborhood watch type thing. We have done some training in apartment buildings with people who are neighbors of someone who's living with dementia. And, you just have a whole bunch of concerned neighbors who say, I don't really know anything about dementia, and most of the people here don't either, but yet we have this lady living here who has dementia, and we're really concerned for her. And so education for people in those situations is key. And we also have this program called Cares and Teach, which is run through Mount Sinai, but also run through the Alzheimer's Society of Canada, or of Ontario, I should say. And this program is really targeted at equipping people who are wanting to give for someone living with dementia in home. And because we recognize how challenging that is for people and how much people don't have the education they need to fill that role. And so to try to kind of bridge some of that gap, there is this program. And so if that's something anyone would benefit from, I would certainly recommend looking into that. It's very skills-based and practical, which can be very helpful.
Yes, in my mind, I'm thinking of something I'm working on in another capacity is age-friendly neighborhoods and community hubs. So this is a community hub. The village is a community hub, but it's one, and it's a pioneering, a really great concept. There's, the keeping people educated or learning all of your life that keeps you feeling, alive and well, I think. And social connection, all those opportunities for social connection, but we need it in places where people might be able to even walk to the facility. And if the role of government is to keep people in their homes, there has to be the facilities that support that. So this has really been informative for sure. But that's the last story. And I'm wondering if you would like to comment in general. Did you learn anything from the stories, or you definitely left us with a lot of information I think that's going to be useful, and I look forward to that, to the connections. Any thoughts? Wendy?
I want to congratulate those people who did have the courage to put their story forward. Again, going back to my comment about a ripple effect, those people are champions. Those people are leaders, and they have the strength that we need in the system to really start to push forward a story about what it's really like to live and be in the front line and caring for our loved ones, and keep the story moving. And I loved all of those stories. I will I will continue to percolate that through my brain over the next several weeks, I'm sure. And I'm just really grateful. Thanks.
You're welcome.
Yeah, likewise, I want to thank people for their vulnerability and sharing those. And also for, people who are caregivers and resonate with these stories and yet didn't put one forward. I just want to, thank them for all the caregiving they do, right? I feel like it's often an under-recognized role,
Yes.
right? People feel under-recognized and underappreciated. And so, thank you for doing what you can, right? With the resources you have and the time and the energy you have, I honestly believe everyone's doing their best. And so I just want to encourage people that way.
Yeah, I think someone mentioned earlier, it is an issue that probably will affect everyone at one point. So for such a widespread issue, there's so much unknown for the caregivers and where to get help and that feeling of loneliness. It's pretty wild to think that probably everyone is going to be a caregiver at one point, but it's probably the most lonely thing you can do. So how to kind of create that bridge to say you are not alone and there is help out there. And I think events like this will certainly help the public to realize that they're not alone and there is help out there.
That's great. Thank you so much.
Thank you.
Thank you.
Thank you, everyone. Thank you so much.